Hi, it's Mary from Insect Shield, and I am super excited to have Dr. Debbie Heaney, a physician from Ann Arbor, Michigan, joining me today. Welcome, Dr. Heaney.
Hi, thanks for having me.
Thank you. And I guess we'll jump right in. The reason we have you here today and inspired us to talk to you and hopefully share some great information is an article that you wrote, or an essay published in the New York Times back in April of 2024, entitled I'm a Doctor. Dengue fever took even me by surprise on vacation. Can you tell us what happened on vacation?
Yeah, so I was in Curaçao with my partner Kyle and another couple, and we were enjoying the beaches, the beautiful weather. I'd never been to the Caribbean in that area before, and things were going fine. We were doing some snorkeling, we were enjoying ourselves, and one day I started getting very weak feeling, started getting pain in my legs. And in fact, unfortunately, that was the same day that my snorkel decided to not work and it was stuck. And so I had to float all the way back from where I was on my back. And I'm not a great swimmer. And I just couldn't do it. I mean, I know I'm not a
Hmm.
good swimmer, but I was just had no energy, no fatigue. I mean, a lot of fatigue. And my friend
Right.
had to actually pull me until Kyle could come into the water. It wasn't too deep and carry me out. So I didn't really know that I was sick yet. I had some aching, but when we got back from that, I just started having, we got back to the Airbnb and I was having severe pain. Um, I had, in part of that ordeal, I had tried to hold on to some rocks and had flipped under and against them. And so I thought I'd broken ribs. I had him checking
Oh my
everywhere.
gosh.
Um, and then I just went and got in bed and I had total body pain that was excruciating. And I started getting hot. Apparently, I was like hotter than Kyle couldn't even imagine, couldn't believe how hot I was. He would touch my skin and it was like on fire. And for the rest of that evening into the next day, I was just sort of writhing, taking Tylenol, probably more often than I should have. Um, and that was the start of it.
So you're on vacation, and so you're towards the end of the vacation? What's happening now?
Yeah, well, we did leave the next day. I was worried if I was going to be able or not. I did have a COVID test with me, so I took that and it was negative. But I didn't know what was wrong. I actually figured it was influenza because what
Oh,
else could make me that sick? And I did a quick little Google search. Like, I had thought I maybe the day before had a couple little bites, but they were smaller than mosquito bites should be. And I messaged my ex husband, who's a physician assistant and actually has an interest in wilderness medicine, and said, could I have dengue? And he said, well, that doesn't fit the incubation period because that was just the day before. Plus, when you hear hoofbeats, think horses, not zebras. We figured it was much more likely that I had influenza. So I wore a mask and then traveled home. There were delays, there were lines at customs, and I mean, had to stand. I wasn't having severe pain anymore. It was, and I was just a little bit warm. I was having some aching, but just wiped out. But I did make
yeah.
it back to Michigan.
So you get back to Michigan and you go visit the doctor because you're still not feeling well. What are the next steps when
Well,
you're
I
you're
got
back?
back and I was too weak to work. Um, I was working virtually anyway, but there was just no
Right.
way. So then I started to get this profuse diarrhea. Actually, nausea and vomiting are more common with dengue, but
Hmm.
whatever reason, I did have a lot of nausea, but I had profuse diarrhea
Yeah.
for like 36 hours nonstop. And
Wow. So you're weak and then have nothing inside you.
right. And I just got sicker and sicker. And I called Kyle and said, you've got to take me to the ER. I need to go to the ER. And he said, can you drive yourself?
Right.
And I said, no way.
Yeah.
Um, and I also had developed itching all over my body, like couldn't sleep itching.
This is, it's like every symptom you can think of. You'd think of, okay, I've got itching, I've got diarrhea, I'm exhausted, I'm feverish.
I know.
It's
And then
everything.
I showed up to the ER crying
Yeah.
at triage saying, give me some IV fluids, please.
Right.
And they evaluated me, gave me IV fluids. Because the other thing is I like hadn't urinated in like a really long time. So it's like I clearly need to get some fluids. But nothing made sense to us on the blood work. I didn't even look dehydrated. I had low sodium, low potassium, low magnesium, low calcium. But what was most worrisome is my white blood cell count was like 1.6, which is
And what would be, what's normal?
4 to 10.
Okay.
Um,
Okay, well.
5 to 10. We were worried about cancer at that point, like leukemia or something. The physician assistant didn't want to alarm me, but wanted immediate follow up. And my liver enzymes were all elevated. So she thought that I'd been taking too much Tylenol, and that had caused my liver enzymes to be elevated. Stop taking Tylenol, start taking Advil, which is actually contraindicated in dengue, and go see your doctor, and drew hepatitis labs and, various things. And I went back home. The itching was severe. I started getting these patches, this rash. It causes like these blood under the skin patches on my backside, up my back. It was just like every day it was something new. I tried to walk, the sobriety test. We call it tandem walking in a straight
Right,
line.
right.
I couldn't do it. It was like,
Wow.
I have foggy brain. I'm like, this is the weirdest thing.
And at this point, how many days are you back?
I think about 3 or maybe 4. By the time I went to my primary care provider's office, I saw someone else there. She was baffled. I went back and looked at all the chart notes today, and not one single note mentioned I'd been in Curaçao.
Yeah, I was going to ask. So, no one asked if you had been out of the country traveling
No,
somewhere.
because the history was, just as far as the timeline of my illness, I was on vacation to Curaçao and I started to get sick. So they knew that, but apparently it wasn't part of the consideration. And so, the primary care provider did all these tests. She was worried, thought, well, we might have to send you to infectious disease or to rheumatology or to hematology, because she just didn't know what was going on. And I went home after that. And by the next day, I was feeling a little bit better, like less foggy brain. And I started looking things up online again. Dengue kind of popped into my head again since I'd seen it before. But it's not even like I knew what dengue was. It was more of a Googling what could happen if you travel here. And
Right.
looked at the list of things and was thinking, And then Ray, my ex I was talking about with the wilderness medicine experience, he and I had been texting, and he asked how I was. And then he said, how's your liver? And I said, well, as a matter of fact, not good. The enzymes were up. He said, I think it's dengue. So at that point, it was like, okay, he thinks that, this is just too bizarre. So I messaged the doctor and said, can you add dengue? And she said, yes, I'll add it, but you'll probably need a whole bunch of other things done too. And then a little less than 2 days later, the test came back positive.
Wow. So, if you hadn't thought of it and asked for it, you could still be on a journey of being sick for a long time. Or does dengue, would you have recovered just on your own?
I would
Okay.
have. I
Okay.
had what's considered mild illness because
Wow. Doesn't sound mild. Yeah.
I know, right? Severe illness is life-threatening, hemorrhagic fever, need supportive care, or you could die, kind of thing. And they never, I don't think anyone would have thought of it until potentially I would have seen infectious disease. I had labs again, and my liver enzymes were trending towards normal. I presume they went back to normal. My white count went up again. Luckily, I had the type that is self limiting, at least in the acute phase. And when they called me with the result, that doctor and my doctor, they were both relieved at that point because I was already better. So they thought I was past the critical phase where I could have gotten very, very ill. So I would have recovered, but there's a couple things I wouldn't have known. One is that the second time you get dengue, you have a much higher chance of getting the severe life-threatening disease because of an immune stimulation that's already occurred. So that's
Yeah, I was
important
going to ask
information.
about that because I noticed you were in your article, you meant or your essay that there is a vaccine, but they don't want to give it to people because you could get more sick. So how does that work?
So there are four strains of dengue. So
Okay.
if you happen to get the second
Did
time,
I interrupt quickly? Did you know this before? Did
oh
you know there
no,
were 4 strains before? Okay. Yeah. So
no,
okay.
no,
Yeah.
yeah, no. Um, doesn't everyone know?
Yeah.
Right. So if you happen to get sick with the same strain, and of course you don't know what strain you have some immunity to that, at least for a while. I don't know for how long. If you get sick with a different strain, you have sort of just enough immunity for your body to recognize it and build um, a response where your immune system kind of goes out of control and you can get very, very ill if you get one of the different strains. Now, when the public health department called me, it's a reportable condition. The guy was not very knowledgeable. He pretty much just said, well, I guess you know you have dengue. And so I said, yeah. And I asked a couple questions. Um, the only information he gave me was the good thing is there's a vaccine and now you're eligible for it since you've had dengue. Because I had asked, isn't it more of a risk to get it the second time? And so he told me that. And then he said, when I inquired, I have no idea where you can get it. We don't give it. So the truth is that the only vaccine approved in the United States is only available to those under 16 years old, not to adults. So those under
Hmm.
16 who already have serum confirmed dengue. So I'm not eligible for any kind of vaccine. And
Okay. Well, that's probably another conversation. Is that just because of the age and the way the body responds? Because to have vaccines under 16, is that a
I'm trying to
standard
remember.
practice
I
for
read
things?
about it. A lot of times vaccines are only approved for a certain age group because that's where they've
Mm,
studied it. I think
I see.
I think some of it's a risk benefit, if I recall, because if you get it and you're younger, they may think that there's such a high risk of they're much higher risk of getting very ill. So sometimes they just approve it for those reasons. Um,
Gotcha.
and also for people who need to go to endemic areas for whatever reason,
Mm-hmm.
visiting family or I don't know. But the number two thing that I wouldn't have known is that well, and you're probably going to ask about this, these local spreads that can occur in
Mm,
in areas.
yes.
Yeah. So what can happen is the way there's traveler cases in the United States, and that's the vast majority of those who present with dengue in the in the continental U.S.
Yes.
There are small pockets, especially in the southern U.S., of locally transmitted infection, which means the person got bitten by an infected mosquito there.
Right. And that's where we like the Florida cases, like the southern, we have, there's some cases. So, but then you could have been, or you were a carrier then and could have created a local outbreak in a sense.
So when I asked him about that, he said, "Well, there aren't that type of mosquitoes up here, and it's early March, and by the time we have mosquitoes, your viral titer will be too low to spread it." So I had asked about that, though. He hadn't even brought it up. He didn't know that I wasn't going to Miami the next week to visit
Right.
family. I mean, it should have been it's something very important to let people know. And when you've had dengue, during that period when you can be a carrier, and what happens is the mosquito, that type of mosquito, the Aedes mosquito, bites you, gets infected from you, virus replicates, and that same mosquito, bites someone else.
Right.
So that is how it's spread. And people who had dengue need to know to protect themselves to wear insect repellent, though if they just had dengue, to wear protective clothing and insect repellent to protect the public. So
Yeah, I don't think because yeah, that's a whole nother thought of it that people I didn't even really think about as much. When I was reading, I saw that it's on the local side, but I think with insect-borne disease, people aren't thinking like, "Oh, I'm gonna become almost a carrier and I can then spread it," where we're thinking of all of our other, with COVID and everything else everyone's been dealing with, spreading it and thinking, so if a mosquito bites me and then bites someone else and, um, you could create your own outbreak, which is yeah, that's frightening. And I know you mentioned so continental US is typically, the traveler, someone coming from outside. But I know we're seeing more. I mean, Puerto Rico, I understand they had a large outbreak, and that was I assume a kind of, it was spreading amongst itself. It wasn't a traveler based.
yeah, they had a dengue emergency this year. And that's actually where the CDC dengue branch is located. They had, hospitals were getting full of people who were seriously ill. I can't think of the number. I don't know the number of cases there, but it was huge. And so 1 in 4 people who gets infected with dengue, gets symptomatic at all. So you've got, when you look at the numbers, you only see people who got tested, and you wouldn't get tested unless you were symptomatic. So the number infected is far greater than the numbers you see. And 1 in 20 gets the severe illness. And if you've got, 1 million people with the illness, 1 in 20 are a lot of really, really sick people. So
Yeah, because it sounds like a debilitating. I mean, it's seeming and you look like you're in good health, and obviously you're out on vacation, you're scuba diving, you're an active person, but probably just like any of these other illnesses, if people are immunocompromised or maybe not in the best shape and health, that they're that much worse off.
yeah, and snorkeling, not scuba diving. I'm way too
Oh, I'm
scared.
sorry,
I'm way,
snorkeling.
I'm way too wimpy to do that.
Okay.
Don't want someone to watch this and say she was claiming she's a
Okay.
scuba diver. Um, yes, and when you get the serious illness, it if you get supportive care, so there's no specific treatment, but you need fluids, you need, your blood pressure might be dropping, you need meds for that, whatever it may be. If you get hospitalized and get good care, you're not going to die, most likely. Those who don't get supportive care, and therefore those who maybe weren't diagnosed, are the ones who die, and it's not a high percentage of them. So, yeah, if you already have underlying weaknesses in your immune system and that sort of thing, but I don't think that's really a necessary component of it. It's just the infection.
Yeah, I mean yeah, you've got like to hear your symptoms and how ill you were. I mean, it's pretty astounding. That'd be so scary. That
The scariest thing was spending, 3 days, 4 days thinking I might have a bloodborne cancer. And
right.
I had told the whole story to colleagues who were also physicians, and they were really worried. Um, it didn't strike them either. I work with a bunch of pulmonologists, and, it wasn't something that sounded familiar to them. So that's what I was most scared about, was that there was something seriously wrong, or the onset of some sort of autoimmune condition, which was the other most
Mm.
likely thing with the labs like they were. And that would be something that would probably be lifelong. So yeah, I wasn't too excited
Yeah, that had to do yeah,
about
it's
that
all it
either.
sounds yeah, it's very difficult, and I'm sure emotionally and obviously physically just so challenging. And one I was thinking of the when you were about the kind of local and when someone gets and carrying it on, there was an article, they were worried about the Olympics that actually there could be a small dengue outbreak in Paris because people were coming from everywhere. So, I mean, I feel like dengue is getting some more attention outside of Thailand and Vietnam and Asia. Have you seen that as well now that you're probably paying a bit more attention to the dengue media?
Yeah, they made a really big deal about the Olympics, about it being a super spreader event. Um, I don't know. I just didn't see that happening. I mean, yes, there have been some cases in France, but not a huge number of them. And I just think that well, I read many interviews and watched many interviews on it. What they were concerned about was millions of people coming together. But it's not like COVID where normal transmission gets people sick. So it didn't end up being the case. And the good thing about it was that dengue in general was getting press.
Yeah.
So I was happy about it. I didn't really think it would happen, um, though I liked that people were thinking about it. And I just liked, in general, the press it was getting. Awareness is so
Yeah, I mean,
important.
yeah, that's it, because it reminds me so much of our work kind of in the tick-borne disease. It's the knowing. It's like, okay, saying I was in nature and you may not have known that you were even bitten by the mosquito, or it's same thing with ticks. People don't realize, like, oh, I never saw a tick. And it's like, yeah, you may not have seen a tick. And just saying to the doctor, hey, I do walk outside, and potentially I was around one. So the awareness, and that's what our goal is, just getting the word out. So people, someone like you is like, wait, I was in a country and I Googled it and it said, oh, they do have dengue, and coming back and being able to say to the doctor, should we add that to the blood list? That seems like,
Well, what happened? And so after the essay was published, a lot of people, of course, read it and reached out to me. But I read some of, and it was shared on their YouTube page and their X site and all that. And I read some of the comments, and a lot of them were very positive. I kind of stopped reading just because there were so many, but several people said, I'm surprised with her background that she didn't think of this. It's textbook, all the symptoms. But I don't know that I had any concept or understanding of this before. I was really sick and just felt awful, and I couldn't really even think straight. Like, I thought about dengue briefly. I was looking at my texts today
yeah,
with
no, you said
Ray.
that you messaged to your yes,
Yeah,
right
I
away. Like, could
messaged.
this be?
Do you think it's dengue? And almost as a joke, because
Right.
oh, I'm one of those people googling things, like who's even never heard of it, right? Um, but I completely forgot about it. I mean, I was just so ill, um, and you just can't really think straight when you're like that. It was only when I started to clear that I thought about it. So it's
Yeah,
tough.
well, I think yeah, and honestly, sometimes the comments people, if they were in the same position, we see how they act. So, yeah, no, it's good that your brain did clear and you could ask and now kind of help advocate, to educate. So what? Yeah, so I was going to ask, like, so the response. So I would assume people are like, this is great. We need to get the word out. So yeah, and New York Times, obviously a publication that has a large readership. Because I was even, I mean, I think, and just some facts like from your article, I mean, Latin America and Caribbean have had 3 times the number of cases this year as reported last year. So, I mean, that's a huge increase, 3 times.
Well, yeah, and it was year to state, I think. And
Oh,
I know that, like Michigan, for example, already had, as of like a month ago, twice the number of cases in all of last year. So, what was remarkable at the time the article was published is that the cases were already higher than the prior year, and it wasn't mosquito time yet.
right. Yeah, that was it was August. I mean, April the 3rd. Yeah.
Yeah. So, if you look at maps from prior years, it's going to be low and then it peaks in, the summer when there's typically more mosquitoes. And this was very unusual. And in fact, when I was in Curacao, I mean, I wasn't smart. I brought insect repellent. I even brought, as I told you earlier, some insect shield pants. And I thought maybe there were little things around. I never saw a mosquito. And we were talking casually to the host of the Airbnb, and I said, "Oh, I might put out some of this mosquito thing she had." And she said, "Oh, there's no mosquitoes now. This isn't mosquito season. You don't have to worry about it now. There are no mosquitoes now." So I just kind of figured there were no mosquitoes. And
Yeah, it's like no, it's like with ticks and people think it's winter and there are no ticks around. And I think one thing too in your article brings up is with things warming and our mosquito seasons are going to be longer and longer. I mean, I'm in North Carolina. I think it's almost all year. There's times that we've got mosquitoes now. So,
yeah, definitely. I mean, the Aedes mosquitoes, which are, the ones we're talking about here, are moving higher up. They were just, very southern, and now they're getting into the southern United States, but they've actually even found them in mosquito surveillance higher. I read an article a few months ago that in Grand Rapids, Michigan, they had found a couple in the pool of mosquito surveillance that they do there. So, and they live longer and the virus replicates faster when it's hotter. So, yeah, it's hard to know what's going to happen. I mean, I know the CDC right now isn't worried about some huge, epidemic in the US of outbreaks, but certainly in the southern part of the US, it's a concern. There's just been a couple cases that people got in Orlando,
mm,
but people are traveling, especially post COVID. People are traveling all over. And for individuals, certainly, it's really important for our providers to be aware of it and for travelers to be aware. In fact, I was looking back again today. So I think I'm a savvy traveler. I always look at the State Department alerts before I travel. So there had been some political turmoil in this area. And that's when I was following. That's what I was following. A health alert for Curaçao was put out of a dengue outbreak on February 20th. We left for Curaçao on the 23rd. Well, by that time, I had stopped my obsessive looking at
right.
so it was just a little too late, or I would have been paranoid enough. And I guess it's not paranoid if it's true, but I would have protected myself.
Or you're a bit more cautious, right? And maybe, and you, when you started feeling ill right away said, oh, not, could this be dengue as a joke, but as a serious, like, this could be dengue.
For sure.
Um, well, I mean, I'm sorry you went through this, but it's wonderful that you've been able to spread the message and kind of just get people educated, for healthcare, for just people, owning it and saying, "Wait, I was just somewhere potentially that dengue was," or also thinking, I don't necessarily have to be somewhere where there was an outbreak. It can be, it's spreading, it's around, so to be alert. So to finish up, what's your when people ask you now because you've become a de facto dengue expert, what do you say, like they're like, okay, what's one thing I need to know or should do? That's two things. What do you say to them?
Well, the most important thing is protecting yourself. Insect repellent, insect resistant protective clothing, and trying to avoid perhaps traveling in peak seasons. I mean, even though there's mosquitoes all year round, going when there's more of them, trying to keep windows closed, go places where there's screens. There were no screens. Doors were just wide open, and these were nice places. There was no air conditioning in the main areas. It's just not practical. And trying to, the people think about, oh, I'm going out in the woods, I'm going hiking. That's not where dengue lives. Dengue is more common in urban areas. And so, not to think, which is what I was thinking, oh, sitting on the porch in my B&B, I'm going to be fine. But to
Right.
protect yourself in all those places, because that's not a safe place either. And the second thing is to advocate for yourself if you get ill, to keep it in your mind, because I think I was the 10th case in the whole state this year when I got sick, maybe the first in my county. I mean, it just now, since then, like you'd said, there's been more news, more awareness. We've gotten things from the um, Michigan Department of Health and all these things. But the odds of a provider having that on their radar, if there's so few cases coming back from traveling. So to emphasize your travel history so that your provider pays attention to that.
Okay. That's excellent advice. Well, thank you so much for sharing your story, and hopefully, it people have learned some things about dengue, and we can help reduce anyone else having to go through what you did. So,
Thank you.
thank
Thanks
you.
for having me, and thanks for what you do.
Absolutely. Thank